Good morning. I'm joined this morning by Dr Scott McEwen from Public Health and State Health Commander Catherine Morgan-Wicks. Today we have 466 new cases in the state, bringing the total number of cases to 1,691. Importantly, we now have only 2 people in hospital. This is down from 3 yesterday, and I think the most important matter to raise here is that they are in hospital not because of COVID-related matters. They entered hospital for other reasons, and but have COVID as part of their treatment. Of our total case count, the vast majority of cases are experiencing only mild symptoms, and around 50%, and I think this is very instructive, around 50% are even choosing not to use the COVID at home program as they are not symptomatic and are in relatively good health. Now, that percentage of people that aren't using that system has been rising. In fact, the other day it was between 20 and 25%. Today it's around 50% of people that aren't ill enough or don't even have symptoms and therefore are choosing not to utilise the COVID at home. And they, broadly speaking, across the board, most people are generally experiencing relatively mild symptoms. I think it's instructive as well just to look at what's occurring around the country at the moment. More than 188,000 cases, but in the main, generally mild. And across the country, there are only 148 people that are in ICU. And as I said, importantly, from a Tasmanian point of view, 2 people in hospital. They're not there because of COVID, and importantly, no one in ICU. Now, we have a highly vaccinated population, one of the highest in the world, and our older Tasmanians especially have a very high level of vaccination. We know that symptoms are generally mild, especially for younger people, and we're in the height of summer, which, as I said earlier this week, if there were a good time to deal with a highly transmissible but less severe strain of COVID, now is the time to do it. I do want to just touch on borders again just for a moment, because I know that, and I've noticed that there's some political discourse out there at the moment in terms of borders and whether we should have opened or not. Now, as I made the point the other day, firstly, we have a highly vaccinated population. That is completely different to where we were back in March of 2020 when we had no vaccination, no protection whatsoever, and locking borders was seen as one way that we could limit and protect our community. Importantly, whilst we are dealing with a highly transmissible strain, it's generally presenting as much milder in those people that are testing positive, and importantly for those testing positive, many of them are choosing not to even use the COVID at home service. And as I said the other day, regarding where we are at the moment in terms of seasonality, at the height of summer, if ever there were a time to deal with a highly transmissible but less severe strain of this disease, now is it. Now, importantly, when you look at what's occurring around the country, every state, including WA, now has cases of COVID. Every state is dealing with this, and importantly, what we're seeing at a national level are that whilst case numbers are increasing as a result of the transmissibility of this disease, what we're seeing is that hospital presentations and ICU presentations are but a fraction of those overall cases. Importantly, I noted this morning some commentary from New South Wales, where they indicated that if there are more than 1,000 people that are in hospital, around 50% of them were not there for COVID-related reasons. Yes, they have COVID, but they had presented for other reasons, broken arms, other matters that had taken them to hospital, and then after being tested, they had COVID as well. So again, I think it's important that we look at the statistics that are occurring. I do want to just touch on businesses. I've spent time in Hobart over this Christmas period. In fact, I've been here for most of it. Most businesses are managing their way through this, and most businesses are seeing reasonable trade. Now, obviously, some Tasmanians are now voting with their feet and they're staying at home as opposed to going out, and that's a matter for them. But it did surprise me yesterday to see that one particular business that had taken preemptive action at a time when I think they'd even acknowledged themselves that they had good custom for their trade. Importantly, as we move forward, we need to continue to do the little things, make certain that we manage our density limits, ensure that with our gathering restrictions in place that we manage them, and it's important to ensure that we all continue to socially distance, and importantly that we wear a mask when we are indoors outside of our home. It's a little thing, I know not everybody likes it. I think most people are starting to get used to it, and importantly, it will help slow the transmission of this disease. Continue to wash your hands, continue to do those small things, and importantly, continue to use the Check-in Tas app. Now, if we need to contact you through that app, that will assist our contact tracers, but importantly, if you are a close contact, it will also give you a record of where you've been, and importantly, if you're positive, to be able to contact those people that you've been with as well. Now, demanding on testing continues to occur across the country, including here in Tasmania. It's important that we do continue to prioritise our PCR testing for those who are symptomatic and for those close contacts that have undertaken a RAT test and that RAT test has come up positive. So let me be really clear about testing. If you have symptoms, arrange a PCR test. If you're an identified close contact of a positive case, that is an identified close contact, that is someone who is a household or household-like contact, and you've spent more than 4 hours with that positive case or in another accommodation or care facility, you must isolate for 7 days. If symptomatic, get a PCR test. If you're not symptomatic, we'll provide you with a RAT test on day 1 and then on day 6 of that 7-day isolation period. Yesterday, around 2,000 lab tests were undertaken, and importantly, in terms of rapid antigen tests, we were able to provide those to those that required them under our rules to around 4,500 people yesterday. We distributed RATs as well. Now, we're continuing to work with Australia Post for post offices to be a distribution network around the state. I think they have around 160 to 170 outlets, and hopefully by the end of the week, all things going to plan, we'll be able to provide RAT tests in regional and rural areas. But again, you only need a RAT test if you are an identified close contact and you've been asked to take a RAT test on day 1 or day 6 of that 7-day quarantine period. If you're symptomatic, go and get a PCR test, and importantly, if you have a RAT test and that RAT test tests positive, go and get a PCR test as well. Health will continue to prioritise the people that require those RAT tests, and we've been pushing out texts to people regularly in terms of the process there, and Catherine Morgan-Wicks can talk about more about that in a moment. Now, there are a couple of higher risk positive case locations which public health are continuing to manage. I want to mention just a couple. One is a small cruise vessel, the Coral Discoverer, which had 2 positive cases on board. They've now departed the boat and are being managed, and the remaining passengers and crew will be tested today before determining next actions, and Dr. Scott can talk about that in a moment. There are around 60 passengers, I understand, and around 30 staff that will be worked through and tested today. Now, in terms of the party in the apocalypse, this was held in Launceston on the 27th and 28th of December. That's now returned around 25 positive cases. And I want to be really clear about this, and I'd ask for the media to be sensible with this as well. This does not mean that everybody that attended Party in the Apocalypse on those 2 days needs to turn up to a testing clinic or take a RAT test. It doesn't mean that at all. But if you were at that event, you need to use your common sense, monitor the symptoms, and if symptomatic, please call the public health hotline and go and get a PCR test. But it doesn't mean that you need to line up today if you attended that event on either of those 2 days and immediately go and get a test. And I just ask for the media to be sensible with that. I think, and I hope that, in fact, I'm certain that most of our young people will be sensible enough just to continue to manage their symptoms. And if they are symptomatic, go and get a test. There are also a number of aged care facilities where COVID cases and close contacts are being managed in accordance with national protocols. Dr. McEwen will provide more of an overview on that in a moment. Now, I just want to reiterate in closing that while case numbers are high, all of the evidence is that Omicron is a much less severe disease. And if you follow the rules, use common sense, we'll navigate our way through this as we've done so in the past. And whilst I can understand people being a little anxious, it's important that people do keep calm. Continue with your COVID-safe behaviours. If you're a business, continue to work your COVID safety plan. That will ensure that you can keep your business open, that you can continue to trade through this period. Importantly, look out for one another. And just secondly, finally, in terms of some of the political discourse, some of it is quite disgraceful at the moment. What we're seeing occur are high numbers of cases, but relatively mild disease. We have the systems in place. it's not impacting on our health system. We have 2 people in hospital at the moment, but not as a result of COVID. And I think that needs to be understood, and we need to ensure that we just step through this carefully, sensibly and responsibly as we manage the transition program that we have underway at the moment. I'll hand over to Dr. Scott to make some comments.
Thank you, Premier, and good morning everybody and Happy New Year. We're reporting today 466 new cases from yesterday to 8 p.m. last night, and this brings the total number of active cases in the state to 1,691. Of these cases, only 2 are in hospital, and as the Premier has indicated, both cases are not in hospital for COVID-related illnesses. These numbers do continue to change, and as new cases are diagnosed and people are released from isolation, the total number of cases in the state will change. But to date, the majority of the cases that we have in Tasmania continue to be people who've experienced mild symptoms, and now the majority of cases involve transmission within Tasmania. From the 1st of January, Tasmania is implementing the updated case and contact management approach that's been announced out of National Cabinet from the 1st of January. And this was recommended by AHPPC, depending upon the setting of the case. And to be clear, a close contact is a person who is from the household of a case or who has had household-like contact with a case, which involves spending 4 hours or more in an accommodation or facility type exposure. We're also implementing the automated process of notifying cases and actively asking them to isolate immediately by message. We're asking them to identify their household and household-like close contacts and to ask those close contacts to quarantine. We're sending out a survey that helps us to identify cases and contacts of a case who work or are involved in high-risk settings, healthcare facilities, residential aged care facilities, custodial settings and disability settings. The survey also identifies priorities for a person to be enrolled in COVID at home, and that relates to clinical and other conditions. We also provide in the messaging out to cases information about their isolation requirements and also the quarantine and testing requirements for their household-like close contacts. A further survey is sent out to cases to obtain more detailed information. So what this means is that most cases won't be directly contacted by phone by public health, but are communicated with by messaging. And depending upon whether they identify priority settings that the case or their contacts work in, or risk factors for needing to be cared for by COVID at home, most people will manage themselves as cases and manage themselves as close contacts, being aware of their requirements to isolate as a case, quarantine as a close contact, and follow as a close contact the testing requirements and how to access clinical care. So public health will continue to manage cases and contacts from high-risk settings, such as those that I've mentioned. Our trend so far since COVID entered our state is that COVID is continuing to mostly affect younger people. At least 85% of our cases are aged less than 50 and around 60% are aged between 20 and 39. And mostly it's very mild symptoms that people are experiencing. I just would like to provide a brief update on priority settings that public health is currently involved in either supporting or managing. We currently have 11 facilities, aged care facilities in the state that are being affected by exposures, either involving a staff member or a resident. And health and public health are working very closely with these facilities and with the Commonwealth to ensure that we follow national guidelines and protect residents, staff and the communities around these facilities. But to date, there's no evidence of any severe outcomes occurring within these facilities involving residents. We also have identified, as the Premier has said, at least 25 people who have been associated with attending the Party in the Apocalypse on the dates of the 27th and 28th of December. We're messaging out to people who've attended both of those days. We've already messaged when we earlier on identified a number of cases that were associated with the first day. We're messaging out to people who've checked in on each of those days today. But the important message is that for anyone who attended Party in the Apocalypse on the 27th or the 28th, please monitor yourself closely for symptoms. You only need to get tested, call for a PCR test if you developed any symptoms, even mild symptoms. I'd like to provide an update as well about our involvement with the Coral Discoverer, a small cruise vessel that overnight we've confirmed that there are 2 confirmed cases on the vessel. These cases have been removed from the vessel. Public Health is currently interviewing these cases and working closely with the organisers of the vessel. The vessel is currently at the port in Hobart and no passengers are disembarking. The vessel has activated their COVID outbreak response plan and will continue to work closely with the vessel to ensure that any risk on board is being managed and to ensure there's no broader risk arising from the case that's occurring, the 2 cases that have occurred. So contact tracing will continue over today and into tomorrow. So I think it's quite important to understand that COVID is circulating in Tasmania. It's having impacts on individuals, families and businesses, and some facilities such as aged care facilities. It's really important though that we each take our own individual responsibilities and do our bit to make sure that we help minimise any further transmission or disruption from COVID. Please continue your individual COVID-safe behaviours. If you're eligible for a booster vaccination, please get vaccinated as soon as possible to continue to help protect yourself. Please make sure you follow the requirement to wear a mask when you're indoors and at events, and consider wearing one in other situations outside of those when you're not able to practice physical distancing. Don't go to work from tomorrow with most workplaces opening up if you're unwell. Please don't visit friends or family if you're unwell. Get a PCR test instead. Continue to make sure you cover your coughs and sneezes. Wash your hands regularly and use hand sanitizer. When you're out and around walking in the street, continue to practice physical distancing. And again, if you're in a situation where you're concerned that it's difficult to practice physical distancing, carry a mask with you. You need to wear it if you go indoors. Please wear it outside if you need to, if you're concerned that you can't physically distance from people. And please continue to use Check-in Tas. We will continue to use it for any situations or locations in which we're concerned about high levels of transmission. For example, the experience at Party in the Apocalypse. My final very important public health messages are, if you're messaged that you're a case, please follow the advice that you're provided by public health in that message. Complete your survey, follow the instructions that you're provided with about how to isolate and how to identify your close contacts. Make sure you inform your close contacts that they are contacts and ask them to follow the quarantine advice that's listed on the website. You will also receive other surveys to complete involving identifying public health priorities or COVID at home priorities and more detail about you as a case. Please complete each of them. Completion will trigger the next message that needs to be sent. The final message is if you're a close contact. If someone's let you know that they've identified that they're a case and you're a close contact, comply with your quarantine and testing requirements. And by following all of these recommendations, we'll continue to each individually doing our part to make sure we help manage COVID in Tasmania and minimise the disruption. Happy to take questions. Look, there's certainly significant transmission that's occurred. We understand at least 5,000 people have attended each day, and for at least 25 cases to be identified across those days, there's been very significant transmission that's occurred, and our message to people on either of those days, the 27th and 28th, is monitor yourself closely for symptoms and organise a PCR test if you develop any. So we have 11 facilities at this stage that are currently affected by COVID, either exposures. A number that have occurred in recent days have been able to be closed. I don't have that figure with me at the moment, but certainly, we have a number in facilities. Some facilities are only affected by staff members that are positive, but it's being managed very safely by health in their emergency operations centres with public health support and working with the facilities and the Commonwealth. Yes, certainly. My best advice is that people follow the advice that's provided in the messages that they are sent. It's common that people receive multiple messages and they may think that they see a message from public health and it's one that they've already read or they have the information. Our advice is to follow what's provided in that message, follow the links to the letters that you're provided and information on the website, and complete the surveys. It's important to follow that advice that we've provided, and that will enable cases and close contacts to follow their requirement. So certainly our recommendation is anyone that has symptoms should book in for a PCR. Close contacts that don't have symptoms don't need to have a PCR, but they should complete the requirement for a rapid antigen test on day 1 or day 6 of their 7-day quarantine requirement. That's our public health advice, and in the information that we send out and the information on the website, that's quite clear. So we're not sequencing all variants at the moment. We do have predominantly Omicron, but some Delta circulating in the community. We do expect most cases to be Omicron. We're focusing our sequencing because we've had more than 1,000 cases. We're focusing on our sequencing where understanding the type of variant circulating could change the public health management. So that's in those public health priority settings where cases involve people in healthcare or hospital settings, residential aged care facilities, and those other priority settings, custodial and disability settings. So they're the settings in which really understanding the type of strain circulating is important. For the average person, it won't make a difference in their management. We recommend cases follow the requirement to isolate for 7 days and follow the information that we provide to them in the messaging and on the website, and for their close contacts as well. Certainly with us automating our processes, with the new case definition being implemented and the significant increase in cases, we did have a period of time where getting our processes in place, transferring from manual calls to automatic, we had to catch up with the significant number of cases. We wouldn't expect a person to wait for that long. It is important that people understand to complete each of the steps of the survey and the messaging that they're sent out to them. They receive an initial notification from the lab and or public health, informing them that they're a case when that's confirmed, asking them to stay put, to isolate until they receive further information. If anyone's concerned that they haven't received that further information, then please call the public health hotline. I'll just look to Kath Morgan-Wicks will respond to that question around testing. Yeah, it was certainly in the bay to the south of Hobart, and we're working with the operator of that vessel now to manage that vessel and to undertake contact tracing. So they're isolating in Hobart in a suitable premises for that to be undertaken, and that manages any public health risk, as any case in Tasmania should isolate appropriately. My apologies. Could you repeat that question? Sorry. Oh, look, certainly our advice is to follow the information that they've been provided as a case. They need to follow the isolation requirements. They need to inform their close contacts that they're close contacts. Their close contacts should follow the advice that the case has been provided. And if they develop any clinical concerns, they should access medical care appropriately.
There's about a 10-day lag between cases and hospitalisation figures, and does public health expect hospitalisations to increase in the next few weeks as a result?
Look, we're certainly monitoring hospitalisations in Tasmania. There are, as we've mentioned, no current cases in hospital for COVID-related issues. Our first cases entered the state when our borders opened on the 15th, and we're certainly monitoring the pattern of hospitalisations in other states. We'll continue to monitor that closely. We do expect that there will be people in hospital as a result of COVID, but with most of the community being vaccinated and this being a milder variant, individuals have COVID are at much less likelihood of having more severe outcomes compared to Delta with Omicron circulating. So we'll continue to monitor that closely and use that to inform our public health decisions and advice. I think it's important to understand that case numbers themselves will become less important as we go forward. Yes, it's an event that's had significant transmission, 25 cases to date, but every day in Tasmania at the moment, today again, we have more than 400 cases, but we don't have anybody in hospital with COVID-related illnesses. So it's important that we understand that events, we want them to operate safely. They operate with COVID-safe event frameworks in place. There have been many events that have organised over the Christmas to New Year period where organisers have implemented safe plans without any incident. Certainly when transmissions occurred, such as in the Party in the Apocalypse, when we identify that, we do want to make sure that people are aware of that risk and follow the advice to monitor themselves closely for symptoms. But I think that continues to be the very important message, is if you have symptoms in Tasmania, no matter how mild, please do get tested. Please call for a PCR test by calling the public health hotline or organising a test via the website.
Morning everyone. Today I'll just provide a short update on testing, current care arrangements and vaccination. So testing remains critical to the detection of COVID-19 in Tasmania, and I can advise that we have had close to 2,000 laboratory tests in state clinics conducted over the last 24 hours, and we have private pathology tests that are added on top of that number. So we are seeing a good response to the change in the testing arrangements with PCR testing for anyone with symptoms, symptomatic close contacts and anyone with a positive RAT test. And we're seeing the proportions of our testing in our state clinics that are asymptomatic reducing. So that's really showing that we are prioritising our PCR testing for those that actually need it. So our RAT tests remain available for asymptomatic close contacts or anyone directed to undertake a RAT test by the Department of Health. And please contact the Public Health Hotline if you cannot obtain a rapid antigen test, and we'll direct you to a distribution point in the south, north and northwest. And importantly, once again, if you test positive on a RAT, you need to immediately isolate and contact the Public Health Hotline to arrange that PCR test. Do not attend a hospital emergency department just because you are COVID positive unless you have emergency symptoms that actually require treatment. Similarly, do not call an ambulance just because you have tested as COVID positive unless you require emergency medical care. So it is important that we do prioritise our PCR testing, which is currently provided at state and privately run testing clinics. And once again, I'll note the difference between our state and our private testing facilities. State clinics in Hobart and Launceston are booked clinics. Drive-through testing, like the site at our Hobart Showgrounds, is privately run pathology and subject to car queues as there is no booking system. So if you do not want to wait in your car and you're eligible for a test in a state clinic, please book with a state clinic. We are also working with the private hospitals to request that pre-surgery admission screening is conducted via rapid antigen test or at a hospital screening centre, and we'll have further information out on this over the next 24 hours. And the state hospitals will not be using PCR for pre-surgery screening, they'll be using rapid antigen tests. So if I can go to COVID at home, our community case management facilities and our hospitals, home is still the vast preferred treatment setting for those who have tested positive and who have mild to moderate symptoms. And the COVID at Home program ensures that individuals are safe and supported and are doing this in a prioritised way. Currently we have 278 cases enrolled in our COVID at Home program, with the majority experiencing mild symptoms. So they're being triaged into our low and low to moderate. And we don't have any COVID at home at the moment, currently in a high risk triage situation. Yesterday, over 300 cases opted out of our COVID at Home program as they did not report feeling unwell. So they have our 1800 number, so if their condition changes, they can contact COVID at Home and opt back into the program. We've also discharged over 115 people from our COVID at Home program over the last 24 hours. So in addition to those who can't isolate at home, we have 56 cases currently in our case management facilities. As at today, we have 2 people, as the Premier has noted, in hospital that are COVID positive but being treated for other conditions. We have 0 people in hospital today that are being treated solely for COVID. We have 0 people in ICU, which is really demonstrating the mild nature of the COVID illness that is presenting in Tasmania at the moment. So if I can go to vaccination, and particularly our booster program that we are rolling out this month now in January. So from tomorrow, on the 4th of January, all adult Tasmanians that are 18 plus who have had their second primary dose prior to 4 September will be eligible for a booster shot and can book in from a state clinic from tomorrow. And from the 7th of February, all adult Tasmanians who have had their second primary dose prior to 7 November will be eligible for a booster shot and can book in from that date. Now, this aligns Tasmania with the most recent ATAGI advice on booster timing. So the Department of Health has developed a strategy to supercharge our state clinic appointments through January and February, as 370,000 Tasmanians will be eligible for their booster by the 6th of March. So while you become eligible for a dose after 4 months in January and 3 months in February, you do not need to have that dose on that exact day. Please be patient and take up the next available appointment. And we have added over 17,000 appointments to our booking system in January for people to book in that booster if they haven't already. And we'll continue to turn on more booster appointments every day, and we'll also be commencing our 5 to 11 program on the 10th of January. So certainly with the changes that we have made to prioritise our PCR testing, we are getting through all of the referrals that are coming through to our state clinics within the day of referral coming through. Certainly our laboratory, and I spoke to the head of our laboratory at the Royal Hobart Hospital yesterday, Dr. Louise Cooley, and she is certainly has significant capacity in the laboratory, and we're experiencing quite good turnaround times from the point that a test is actually taken to receiving your SMS of your result. So within our state clinics over the last week, and we've had particular surge conditions over the last week, they range between 24 hours and 30 hours was at that maximum when we did have a particular surge, but our understanding is that they are back under 24 hours. Now, if you have not received your test result from a state clinic within that time period, please do contact the Public Health Hotline and ask them to check if the result has come through. And our testing hub can get back to you to confirm, but the vast majority are receiving it within that average time of 24 hours. So the 2,000 or so that are being reported are only tests that are conducted in our state clinics. We also have added private pathology capacity all around the state. And we're also working to increase our state capacities. We have our teams or technicians that have actually been joining over the last 10 days, in fact, and have been training and put into operation in our state clinics. So we will continue to work to increase in both state and also with our private pathology, noting that we have been impacted by some holiday times, particularly in private pathology with so many public holidays over the last 7 to 10 days. Certainly we are keeping a close eye on that because other states have reported that people are calling an ambulance when they get a test result that they're COVID positive, and that is just simply, we cannot have that situation happen. Ambulances must be prioritised for emergency medical care, and it's about probably getting some better information out to the public on who can I call if I am concerned. So noting that if it's an emergency medical situation, it is about calling an ambulance or attending an emergency department at a hospital. If it is a general question about booking a test, booking a vaccination, or asking about a result, you can actually call our public health hotline. Our COVID at home number is an 1800 number that we provide to every single person that tests positive in Tasmania. This is a line that's staffed by doctors and nurses and are there to talk to you about symptoms or deterioration. They're not there to actually walk you through what to do with your business, should you have a COVID positive there. So I think we're going to work to try and improve that information out to people and support them better to manage their particular situation. So it is our expectation that access to rapid antigen testing will start to stabilise throughout January, and certainly there are significant contracts that have been placed both by the state, so Tasmania with its order of over 2 million rapid antigen tests, and we have already confirmed delivery dates for those 2 million tests, and also the Commonwealth and every state in Australia. So they are working, the Commonwealth is certainly looking at the coordination of rapid antigen test access, and suppliers are also stating that they're expecting their supply to also stabilise through the month. So I know people are probably a little bit anxious and frustrated about attempting to get a rapid antigen test at the moment. We do expect it to improve over coming weeks, and if you need one, if you're a close contact that is asymptomatic and has been directed to take a RAT test, please contact us and we will make one available to you. So for our regional and rural areas, we have set up distribution points for rapid antigen tests in both the north and the northwest. And we will work, please just contact us and we'll make sure that we can get a rapid antigen test to you. We're also working with Australia Post that has over 170 outlets and agencies across Tasmania to set up the rapid antigen test distribution. No, and it is very important that, as Scott has walked everyone through, that when you test positive for COVID, you'll receive your result from the laboratory via text message. Via that very same number, we will be sending you a survey to ask questions whether you want to opt in or not to the COVID at Home program. Also to identify if you work or have close contacts in priority settings, or if you have any comorbidities or other health conditions that might mean you are prioritised for COVID at Home. When you choose to opt out of COVID at Home, you still must remain isolated. So you still have to follow the conditions and restrictions Public Health set on you as a positive COVID case. And remembering that you can choose to opt back in or ring the 1800 number for COVID at Home if you've got any concerns about your condition. So we will Or also, we can't run just the percentage off the state clinic test results, so it also includes private pathology test results. But it is running at around that 20% if we take into account the private laboratory.
Thanks, Catherine. Look, obviously, I would hope that every business would have a COVID-safe plan. Importantly, they should absolutely have a COVID-safe plan, and they should work that COVID-safe plan. Now, what does concern me is that if businesses decide to take public health advice into their own hands and close their business for no good reason. What I would advise all businesses to do is to ensure that you take every step that's outlined in your COVID-safe plan, that you ensure that your staff are wearing face masks, that they appropriately socially distance, that you ensure that your customers are appropriately socially distanced. That will keep you in business. And importantly, I think that's something that I would hope most businesses would want to see. Look, and with some businesses in terms of close contacts, obviously now with the new definition of close contact, I would hope that we would see workforces continuing to remain in place longer or at least return earlier. But the most important thing for businesses is to ensure that they remain calm. Unless a staff member is identified as a close contact of a positive case, there's no need for them to take a RAT test, there's no need for them to self-isolate. What we need to do is ensure that within the business, the COVID-safe plans are in place. That is, that people wear face masks, that they have appropriate hygiene measures, and that importantly that they ensure that their customers socially distance. Well, we've always had the supports available for those that would need to isolate. So if they're positive or a close contact, the Service Australia's website, or they can have the pandemic isolation assistance grants from the state. But there's available up to $750 for a 7-day period. If it extends longer than that, they can have a further grant. And importantly, if somebody needs to not go to work so that they can get a test, there's a pandemic isolation grant available for them if they don't have appropriate leave to support them. So for casual workers, those supports remain in place.
What about business owners who have a majority casual workforce who might have multiple cases and not be able to open staff? Is there any support for them?
Well, again, in terms of staff, we'll take care of those costs. But in terms of businesses, what I would suggest very strongly is that they continue to work their COVID-safe plan. Now, as I said yesterday, there was a business that closed. I was very surprised. My understanding is that that business has been very busy over the period and obviously working to a COVID-safe plan. So to take the steps that were taken yesterday, to me, seemed a little extreme. What I would suggest to businesses is that you continue to manage your staff appropriately, make certain that in terms of the close contact definitions that where staff are identified as a close contact, that they do the right thing, that they do self-isolate. But I've heard anecdotally of a number of people that have been suggesting to both business owners and also to public health that they are close contacts because they think that they were in a certain location with someone. If you don't meet that definition of a close contact, that is been in a household for 4 hours or a household-like setting, then you're not a close contact unless directed by public health. And so I just say to people, just manage your COVID-safe plans, work through this sensibly, remain calm, and if in doubt, reach out for assistance either through the Public Health Hotline or Business Tasmania, which I understand was available right across the holiday period and only had a small number of phone calls to it. Well, I think as I've noticed, at some of the large events, security actually reminding people to wear their mask. What I would say to people is, it's only a little thing that you can do that will keep both yourself safe, your friends safe, and importantly your family safe. And just in terms of young people who are obviously those that are the highest proportion of those that are becoming positive cases. There was a question asked just a moment ago in terms of whether or not they need to stay at home if they turn down the COVID at home support. Absolutely. If you are a positive case, you must remain isolated and you must follow the public health advice. You know, it's important that just because you have very mild symptoms or no symptoms at all, that you don't continue to circulate in the community. It's important to ensure that we can not spread the disease to your family or to your grandparents, and to young people I would say just be sensible with this. Well, importantly, those businesses that have a no vax, no entry requirement, they need to ensure that they make their own arrangements in terms of that. But again, I would say to all Tasmanians at the moment, we're closing in on around 98% first dose vaccination for people over the age of 16. We have a very high vaccination rate. But for those that are unvaccinated, I would implore you to get vaccinated. It's our best defence, and importantly, you are exposing yourself to risk of disease if you aren't vaccinated. And so, you know, there's nothing smart about turning up to an event and sneaking in because you're unvaccinated. You might just be the one person that ends up COVID positive and ends up in a hospital bed. Now, if you're not vaccinated, you know, make the call, roll up your sleeve and get vaxxed. And if you're doubtful about it, talk to your health professional. Well, look, that's the first that I've heard of that circumstance. We've made available freely at airports and at our seaport rapid antigen tests. You know, my understanding is that as people are coming through, that they should be provided with a rapid antigen test. If that's not happening, I'll follow up that particular situation. You know, some people I would expect would be carrying rapid antigen tests with them as well, and may not want to receive one from the state. But you know, I'll follow that matter up. Well, it's certainly my hope that there will be. I don't have any advice that it won't. Obviously, within the playing groups, they are managing COVID positive cases as well at the moment. At this stage, there is no advice that the test won't be going ahead. But obviously, we remain in contact with Cricket Australia. I think that as we come to learn to live with this virus, and I know that there are some my political opponents out there that at the moment are trying to make whatever they can and drive fear into people. What we need to understand very clearly is that we're not dealing predominantly with the Delta strain as we laid out our plan for. We're dealing with Omicron, which whilst highly transmissible is certainly demonstrating that it is a much less severe disease. It's going to cause some disruption because we will obviously have a higher case count, but the important thing is that we focus on what the impact is on our health system and more broadly across our community. And at the moment, the impact on our health system is very, very low. In fact, only 2 people in hospital, neither of them as a result of COVID-related matters. So what I'd say to Tasmanians is just keep your head. Others around us will lose their head at this particular time. It's important. Tasmanians, we've done the right thing over the last couple of years. We are in a great position at the moment in terms of the fact that we've got one of the highest vaccinated populations, not just in this country, but on the planet. Omicron, whilst being highly transmissible, is turning out to be a much less severe disease than what Delta was. And importantly, we'll be dealing with this through summer, which is going to be much better than dealing with it on the cusp of winter. We do. Look, the first cases that arrived here in Tasmania were Omicron, and so what we've done, as Dr. Veach has said on many occasions, is we've dealt with each case on the basis that it is Omicron. In terms of the genome sequencing, we're doing that in our high-risk settings, as Dr. Scott has just advised. But importantly, our plan that we laid out was set for Delta, which was a much more severe disease. What we have now to deal with is a highly transmissible but less severe disease in the main. If that's the type of COVID that you're going to get, then it's probably the right type of COVID as we work our way through this. The other point, and I do want to make this point just following on from Catherine Morgan-Wick's point about boosters. If you are due for a booster, make certain that you do book in. You don't have to get it on the 4th of January, but you need to book in if you're eligible. That's important. It will be one of our key defences, and importantly, I think will help slow the spread of Omicron. That's certainly what appears to be the national view in terms of the spread of Omicron. So if you're due for a booster, make certain that you get it when it's due, but you don't need to get in and rush in on the exact day. Just make certain that you get a booking over the coming month. Oh, look, I'm not going to play games with Labor on those sorts of matters. At the end of the day, the agreed position that was put to National Cabinet by HPPC was for that close contact definition. Now, here in Tasmania, we'll follow that definition, but again, public health will make decisions about high priority settings. That's what public health will do in each of the states and jurisdictions. But the agreed position, as I explained, I think it was, if not yesterday, the day before, the agreed position by AHPPC that was put to National Cabinet was for that close contact definition.